Welcome to a realm where clinical duties seamlessly intertwine with ambitious research goals. Balancing these two domains demands not just skill, but dedication and strategic planning. Yet, it's a journey that, when routed correctly, can lead to both professional fulfillment and advancement. Let's look at some key strategies for successfully balancing clinical responsibilities and research pursuits. First, prioritize and organize. Determine your significant clinical responsibilities and schedule dedicated time slots. Make a schedule that includes specific blocks for your research activities. This lays the groundwork for creating a structured routine. Time management is essential. Divide your day into manageable segments. Make specific time slots for clinical duties, research, and personal commitments. Maintain a sense of control by sticking to your schedule as much as possible. Collaboration becomes your secret weapon. Form collaborations with colleagues who have similar research interests. Assign tasks, whether in the clinic or at the research facility. This not only reduces your workload, but also creates a supportive professional environment. Flexibility and adaptability are essential. Recognize that there will be times when clinical needs take priority and others when your research requires a greater focus. Balancing these demands requires a flexible response to changing priorities. Don't forget the importance of self-care. Balancing clinical duties and research can be demanding, so make time for relaxation, hobbies, and personal well-being. A rejuvenated mind is more efficient and resilient. Thank you for joining us on this informative journey of balancing clinical and research responsibilities. We wish you success in your endeavors, and may your efforts lead to advancements that benefit both your patients and the larger scientific community.